What's up? I'm Hutch, and you need to better understand pulmonary anatomy so that you can treat your patients with lung conditions, and also pass the NPTE. Your respiratory tract is split into an upper and lower section. In the upper respiratory tract, there is the nasal cavity, the pharynx, and the larynx. The goal is to bring air in, humidify it, warm or cool it, and provide filtration. The lower respiratory tract includes your trachea, which branches into two bronchi, which then branch into a bunch of different bronchioles. At the end of these bronchioles are bunches of alveoli surrounded by capillaries. The main goal of the lower respiratory tract is cellular respiration, or bringing oxygen from the air into your blood through these alveoli and capillaries, or bringing that excess carbon dioxide out of your blood through these alveoli to be exhaled. Your lungs are split into lobes, which are then subdivided into segments. Each major bronchiole roughly corresponds with a segment of your lungs. Your left lung is slightly smaller because your heart resides on this side of your body and it's got to make room for that. So it only has a superior and inferior lobe. The right lung has a superior, middle, and inferior lobe. And then those lobes are split into several segments. The lungs are surrounded by a sac called the visceral pleura. The inside of your chest cavity also has a pleura that lines it. This is called the parietal pleura. Normally between these two pleura there is serous fluid, which helps to provide a little bit of shock absorption and cushion your lungs there. However, when injured, this space can also fill with blood, air, or pus. Inspiration is an active process that during quiet respiration only involves the diaphragm and the external intercostals. However, if you get a little bit more worked up, or if those muscles aren't functioning quite as well, your accessory muscles can kick in to help with inspiration as well. This includes your sternocleidomastoid, your scalenes, your pectorals, and your serratus anterior. Expiration is a passive process that usually occurs from your diaphragm and your external intercostals just relaxing and letting that air out. However, again, when needed, you have accessory muscles that can help force the air out of your lungs. This includes your rectus abdominis, obliques, and transverse abdominis. In a healthy person, expiration is usually 2 times the length of inspiration. Now it's time for NPT Jeopardy! Pause the video now if you want time to read and think about the question. Otherwise, you've got 5, 4, 3, 2, 1. Due to the heart taking up additional space, the left lung is slightly smaller. Hopefully that covers all of our bases. If not, you can always check out the description box below for a link to my notes. Otherwise, you can comment with questions or suggestions for videos I should do in the future. Good luck studying. Go change the world.